Okay, so without further ado, I'd like to introduce our two speakers. Fiona Worral, who's the Strategic Director for Neighbourhoods at Manchester City Council, and Michael Salmon, who's a Programme Lead for our Manchester Funds. And I'm going to turn us over to Fiona. So Fiona, thank you very much for agreeing to come and speak to us, and over to you.
Thanks, Nigel. I have to say this is the first time that I've done a call like this to so many people. We're all getting used to all this new technology, aren't we? Hopefully you can hear me okay. Is it coming through all right, Nigel? Yeah, okay, good. So thank you all for taking the time and inviting me to speak today, and I'm sure Michael will say the same. When Nigel got in touch last week, clearly the work of the VCSE sector in the city has been really, really important in our response. I was really happy to come along and talk to you today. I think as well, it's really important this week is Mental Health Awareness Week, and I don't know about you, but I think last week, particularly, a lot of colleagues that I work with found last week to be harder than any of the weeks that they'd had previously. Don't quite know what that was about, but clearly working in this very different way and dealing with all the challenges that we're dealing with does take its toll. So if you are thinking about what you need to do this afternoon, think about being kind to yourself and find something nice to do as well, because we are all right in the middle of it all the time here. So I know that a lot of you have indicated, and thanks for doing that on the spreadsheet that Nigel shared, the sort of areas that you wanted to cover. Nigel said, how long will we need to speak? Well, to talk about everything that we've been doing in the response phase, and particularly the way that the VCSE sector has contributed to that, we could be here all day, so I'm not going to do that. But as Nigel says, there are two reports that went to executive on the 6th of May, both quite weighty reports. One set out the approach to the response phase, and the other one set out the approach that we are proposing to take to what's known as the recovery phase. And I'll say a little bit more about that in a minute. And there's a lot of detail in there, and we'll get those reports out to you straight after this meeting. Michael is on the call, as Nigel said, and he's going to talk in a bit more detail around some of the work that him and his team have been doing, particularly around supporting this particular sector and what's next. So as you all know, we declared a major incident on the 20th of March, and that was based on the advice and information coming from the government and the World Health Organization that we were now in what was officially seen as a pandemic phase. And I think a lot of you know, because you've been involved and we've talked before about emergency management, that the council has a particular role in responding to emergencies, and pandemics is one of those such emergencies. And that includes a whole range of things that we need to do. So all of those arrangements were stood up from actually before the 20th, because they were stood up in anticipation, but everything started to move at pace after that date. Governance through the strategic coordination group with colleagues across Greater Manchester, police, fire and rescue, public health, NHS, etc. all were then, they'd already been stood up at before that point. I don't want you to think that we waited till the 20th to do all of this, but it had a different status attached to it from the 20th, once the government and who made that announcement. And you'll know that what then happened was on the 23rd of March, government then issued very, very stringent guidance about people only going to work if it was absolutely necessary, working from home, and all of the restrictions that we all have referred to as lockdown. And we know that that has been absolutely unprecedented and impact on every part of our lives, our communities, our residents and our city. And it's not something that we've ever had to think about, not just how we manage it, but how we get out of this phase as well. And we know that some parts of our communities, and I think you're probably a lot closer to this than many of the many of you people who might work in the council are, because you're at the front face of this more or less every day, is that we know that some people and some communities have been impacted significantly more than others, and I don't think we properly understand the quantum of that yet. So whether that's our BAME communities, whether that's people who are already experiencing significant issues in their lives, whether that's people who were already victims of domestic violence and abuse, we know that all of those things have become even more pronounced through this pandemic. And you know, we will really only see the proper results and the outcomes of that as we move forward. But what's been really important, though, is the way that services, both within the council, within other public agencies and yourselves, have come together to very, very quickly establish very clear support mechanisms for those residents that were seen as most vulnerable. And the community hub, which I think many of you have been working with, was established on the 30th of March. And we have received over 12,000 calls to that hub. There's in excess of 2,000 food parcels being delivered every single week, and we don't believe that everybody who needs support from that hub has yet been in touch with us. I think you might see some of that when you go on Twitter. Every time we put something out on Twitter, there's more people that come forward to say, we didn't know about this, how do we access support? I think one of the big challenges, though, that we've got is we've all received lots and lots of information. So the government have got a whole number of categories: shielded, highly vulnerable, clinically vulnerable, and trying to work your way through all of that data and information in real time has been a real for us. But what it's also done, though, is given some real opportunities for learning. So we certainly believe that we have been able to identify and more nuance some of the support that people need as a result of the data and information that we have received, and hopefully you started to see some of that as well on the ground, particularly those working directly with the hub. I think the role that the sector, the VCSE sector, has played, though, has been really important. And I know you haven't waited for things to be stood up. I know that the groups that you're already working with, you have put in place significant arrangements around how you work differently, how you provide support to those groups and organisations and communities differently. And that has been really, really fantastic to see. And I know Michael will talk a little bit more about the support that is in place and will continue to be in place for that sector. But I think one of the big challenges has been that all of our services have had to very, very quickly shift away from either face-to-face, being run through public buildings, or even out face-to-face in community buildings. And we had to do that massive shift to online or digital very, very quickly. Some of the things that we all said or all thought weren't really possible or weren't really how we could work actually have proven ourselves to be wrong in that. I think the digital world as well responded really, really quickly. So even things like Zoom or WebEx or Microsoft Teams, they have all significantly updated all of their technologies to be able to support that way of working. And you have seen things like even GPs doing digital consultations with their patients, which has been really, really good to see. And certainly all of our services have moved away from face-to-face, so that there isn't anybody coming into the town hall, into what was the rates hall and things like that at the moment. All of those connections are being done online. And there's been some really fantastic examples. I can see Lisa on the screen here, Manchester, who have really gone out of their way to make sure that our young people have been effectively supported at home with play schemes in a bag and all sorts of things that we probably never ever thought about before. And there's a lot of learning from all of those things that we will want to take forward for the future. I think one of the key things out of this whole response has been that there are many different ways that we can think about doing things for the future, and going back to what we used to do before probably isn't an option for any of us. The challenge we've got as well is that we know that COVID-19 is going to be with us for a long, long time. You know, there is no cure, there is no vaccine. Testing is at its very early stages at the moment, and I will say a little bit more about the contact tracing and testing models that we're developing in the city. But we know that we're going to have to learn to live with a new normality for a considerable period of time, and having done that, you don't go back to what life was like before. I'm just going to hand over to Michael just to talk a little bit around the VCSE sector support particularly, and then I'm going to talk then about what's known as the recovery phase, which is difficult terminology, but in the civil contingencies act, that's what it is known as, and we'll talk through what does that look like and the key strands that as a city we're intending to take forward. Michael, do you want to just come in there?
Yeah. Hi everyone, good to see so many different faces, a lot of people I've not seen for a while. Hello Stuart there, nice little wave. I just wanted to say, like, obviously for us as officers working in the council, I'll just speak about myself and my own team really, it's been one of the strangest and most surreal times to be able to be working. And I think I, like many others in the first few weeks, it felt a bit like organised or unorganised chaos of people with the right intentions, rushing around, trying to do various different things and get things in place. And it's been similar in the council where we try to talk to each other, keep in contact with colleagues at Macc, keep in contact with people in neighbourhoods and in communities. And for me, directly on the programme I manage, which is the Our Manchester Voluntary Sector Programme, I think the most important thing really early on was to say to all the groups that we're funding that, you know, we're with you, we understand, we're going to be as flexible as possible and use the funding to do what you need to do right now for your staff, but also the people who are accessing your services. And we've carried that forward, and it's been a message that we've tried to push right across the council, wherever we're working with voluntary sector organisations, such as yourself and others who are not on the call today. Let's be as flexible with our funding, let's relax monitoring, let's try and reach those people who are most in need, let's try and connect people into the information at the right place and the right time. And that's been difficult in the first few weeks because, as I said before, it was quite frantic and there was probably lots of duplication and people trying to do the right things, but not necessarily in the right systems. But what has emerged over the last, I would say, 4 weeks in particular, is how conversations between the council, voluntary sector organisations, Macc, housing providers, is starting to be much more coordinated. So as we're moving forward now into some of the recovery work that Fiona's going to be talking about, we are thinking about our relationship to different funders. In the first phase, some of the emergency funding that's come out through Wheel of Manchester, very much in conversation about them trying to look at emergent responses to the COVID situation. And now as we start to think about what comes next, we are trying to work on developing a Manchester voluntary sector funding strategy between Young Manchester, OMVCS, Macc, bringing together Wheel of Manchester, bringing together the lottery, so we can really think about how we can coordinate our efforts and our resources and how we can maximise and bring whatever funds are coming into the city direct to the sector. It's going to take a bit of work, and I'm sure there's going to be some consultation and engagement around how we do that. It's still in development, but what I just want to give people a reassurance of is within what Fiona's describing today, voluntary sector is high on the agenda within the council and very much at the heart of what we're trying to do. And all the recovery work and work streams that we've got now for residents and communities very much are about connecting and working in partnership with the sector. I'm doing some work at the moment with Macc and the Manchester and Trafford hub around PPE equipment, for example. We're looking at the demand of that this week, and we're thinking about how we can try and streamline things to make that even better. So some up-to-date information on PPE specifically has been recently updated by the Manchester and Trafford hub on the Macc website. There'll be other things coming through, and like I said, we are having that active funding conversation now with the lottery and others. So when you're thinking about that national charity funding that got announced, that the lottery is starting to administrate, we are trying to have conversations about how we can make sure that addresses needs and gaps. You'll have to just excuse me for 1 second because my 3-year-old has just interrupted. I won't be a second. See, Daddy's on a call, baby. Yeah, no, it's okay. I'm fine, Daddy. Minnie?
Well, that's you know, that's realities of working at home with small children, really, isn't it? Fiona, do you want to come back in? You're muted at the moment.
Sorry, I didn't realise that was still there. Am I muted?
You're fine now.
Okay, no problem. Yeah, I think that happens to everybody. It's one of the I always find it very amusing, actually. I know it's quite stressful for the people who are trying to get the children back under control, but it's just life and the way it is at the moment. Yeah, so just in terms of recovery, and recovery is a difficult terminology, but basically it is about how do you get over the current circumstances and move forward and get back to either the way you were before or a new normality. I think the challenge in this case is that usually when we're looking at recovery in a major incident or emergency situation, the incident or the emergency has happened and therefore it's over, and then you're looking at what next, if you like. The circumstances we're in at the moment is we're still very much live. You know, we don't know whether there'll be a second or even a third waves. You know, this isn't just something that's happening in the UK. This is a global incident, and none of us really have any idea of how it will translate over the next 6-12 months. We hope, and we want to hope that you know, there is a level of control so that people can start to live their lives in a bit more of a normal way. But we're very, very conscious of that in terms of putting forward the proposals for how we manage the next phase. You will all know about the Our Manchester strategy that was developed in 2015 and runs to 2025. And we had always planned to not fundamentally refresh, but to keep under review at the 5-year interval what that needed to look like, as we have done with community strategies before. So in some ways, it's quite timely that we do that. And therefore, the Our Manchester strategy, which fundamentally impacts on all parts of our city and the way that we work, the way businesses work, the economy, what our residents want from us, and the support that they need to do that, is all part of the Our Manchester strategy. So we are taking the opportunity to refresh that. And what that means is, in the same way that we develop that strategy, there will be a whole series of engagement with different sectors over the next 6 months, with a view to having that refreshed for March, April next year, 2021. The Our Manchester Investment Board met yesterday, and there were 4 reps from the VCSE sector in that discussion, including Mike Wild from Macc. And we agreed there, you know, the importance and the fundamental requirement to have that ongoing engagement. So in a very short space of time, you will hear more about some of the open engagement sessions that we are proposing to hold, to discuss with different sectors what that means for them and the areas that they would like to consider within there. There will also be some more formal communication as well, and the opportunity to submit, you know, written or survey type material as well that will reach a wider audience. But the key areas that we're looking at in terms of the recovery strategy, underpinned by the Our Manchester Refresh, is first of all around the economy. We know that the economy, not just ours, but on a global basis, will be massively impacted by the issues that we've seen. We know that we've got a government retention scheme in place at the moment where people are furloughed, and we know that there's been support for businesses through small grants, business rates, things like that. But it's absolutely fundamental that we support and enable businesses to get through this phase and to recover, because businesses are where the jobs are, and fundamentally part of getting people to be able to have control of their lives, be independent, do things for themselves, is access to employment. So it is a very clear part of our strategy, and clearly will be informed as well by the government's approach to businesses and how they manage. Clearly, what we know from businesses throughout, not just through the city but nationally, is that some will really, really struggle to survive this, and the longer that challenge goes on, the harder that will become. But we will work very closely with that. And Eddie Smith, who a lot of you might know in the council, is our Director of Growth, is overseeing that work at the moment and working directly to the leader on that, and supported by Pat Bartoli, who is Director of Growth in the city. The significant part, though, of our recovery phase, and probably one that you want to hear most about, is around our residents and communities. And this is where we really think through. We know that we've got a significant number of vulnerabilities in the city. We know that we've got a significant number of residents, communities, families, etc., that are not just struggling because of COVID-19, were struggling beforehand, and COVID-19 has had a significant impact on. And we know we're starting to see early reports of, and I say early because the evidence, the detail behind all of that isn't yet properly available to us, but we know that the information that we're receiving at the moment is telling us that our BAME communities have been impacted significantly more through the COVID-19. I think there was a report last week that 25% of deaths nationally have been people with diabetes. So there are long-term health conditions that are clearly impacting on how COVID-19 operates, and none of us really properly understand all of that yet, because it's too early to know all of that detail. But we know enough to see that people with existing vulnerabilities are being impacted more. We are seeing increases in domestic violence reports. We're seeing increases in people saying that they have, the issues that they're dealing with at the moment is creating an impact on their mental health. Even people who didn't necessarily have mental health issues beforehand. And therefore we have got to think quite innovatively about how we understand that demand and how we put in place support for that for the future. The challenge in all of this, though, is that there doesn't appear to be any new money. You'll be seeing the reports around the impacts on all organisations in terms of funding, because we do need to continue to respond to COVID-19. And there's a lot of work going on through Carol Cully, our City Treasurer, to understand what the financial impact will look like, certainly for the council, but then obviously other organisations will be doing the same, and we'll be looking at that over the next 6 months. But that strand around understanding those vulnerabilities and what sort of support needs to be in place, what does our hub need to look like, how long does it need to be in place for, what sort of offer does it need. One of the challenges that the way people have had to respond to the restrictions put in place is that in some cases it has required people to be more dependent than perhaps they would ordinarily be on services, so for example food deliveries, and we need to be clear about how we can support people to regain that independence, regain that confidence, and safely operate within our communities. So not assume that everyone in that group that's receiving the 2,000 food parcels a week will necessarily always need that. It will depend on what a new life, what a new normal looks like, and what sort of restrictions are lifted. The equalities strand, therefore, is going to be really, really important, and not just around protected characteristics, but what does our overall approach to inclusion and understanding the social economic impacts. What's the evidence that we've got there? What's the data that we've got there? What does the conversations and engagement with people like yourselves and directly with our residents' communities, what is that telling us in terms of what does an offer look like for the future, and how does that influence some of the services that may not exist at the moment but might need to exist for the future? And in doing that, what do we stop doing that we've always done, or do we do it in a different way, and what does that look like? And that needs to emerge from discussions and conversations. You'll know that we have got a family poverty strategy for the city. We have got an inclusive growth strategy for the city, and all of those will be updated and refreshed as part of this work under the banner of the Our Manchester strategy, so that it is influencing both our funding arrangements but also the way that services are designed and offered for the future. And co-production has got to be right at the heart of that. And we know that within your sector, you have got a lot more expertise than public services, statutory services have in that. And I know that some of the work that we've done together over the last few years will really put us in good stead for how we take some of those things forward for the future. There's a lot more government guidance to come. Some of the work that we're doing at the moment is on our testing and contact tracing approach, so working directly with government. Some of the people from our city in environmental health and public health are working directly with government on some of that. There's a national programme, but we also need to understand what does that look like locally, and how robust that is will determine how confident people are to once restrictions are lifted to start to come back out into the into our communities and to be able to live and work cognizant of COVID, but in a different way. And the same around lifting restrictions. You know, we're expecting the next round of significant government advice round about the end of May, beginning of June. We know that there's already lots of detailed trailing around what will our schools look like after the 1st of June. And certainly in Manchester, we're working directly with our schools to come up with pragmatic solutions for how they will be enabled to operate after the 1st of June. And it will be different. What Paul Marshall, our Director of Children's Services, will be very clearly saying is that our schools actually haven't closed. Many of our schools are still open and providing services to children of key workers, providing online education or digital access and work packages that children come in and collect. So it's not that they've closed and need to reopen, but we do need to look at how attendance is increased over the next period, but in line with government guidance and working directly with schools.
Yeah,
so, sorry.
Fiona, just say 1 or 2 more minutes, and then we'll move to questions.
I knew that Nigel was going to say that. I'm going to wrap up now, actually, because as I said at the beginning, we could talk about all of these things for a long, long time. There's a lot more detail in the reports, and as Nigel said, we will come back with more information. And I think what I'd want to say as well is that we can consider this to be the first of these events, not the only one that we'll ever do. And we'll talk to Nigel about how we do that. But I'm happy to pick up any questions, or if there is anything that people particularly want to talk about.
Thank you very much indeed, Fiona. That was really fascinating, interesting presentation about what the City Council is doing and also relationship with the voluntary sector. Michael, is there anything more that you want to say? You've only got a minute though.
Yeah, I'll be really, really quick, and thank you for everyone's patience while my 3-year-old absolutely lost the plot with me. We won't be friends for an hour, but we'll make up soon. Just to say that I've had quite a few direct questions just about the Our Manchester voluntary sector funding, and I think we've been as open as possible with our groups that because of the COVID situation and the ongoing budget situation, the council will be re-looking at its budget around June, July time. And then further down the line, we'll be looking at how our budget for our Manchester voluntary sector will continue, hopefully into the future. So we have got a strong kind of direct line into the treasurer about why that funding is so important. And any other funding that we get will be continue to be important to support the sector. Just to let people know that it isn't being forgotten as part of the budget setting conversations. We're very much in there, and we will come out with some further detailed information after that.
Okay, I'm now going to pass over to Danny, who's going to put the questions from the chat to Fiona and Michael.
Brilliant. So we've had a good few questions, starting off with Stuart from Macc's capacity building team, who says his question for the panel is about how VCSE groups can access the discretionary grants from Manchester City Council. I don't know who would like to take it. Fiona, Michael?
Do you want to pick that, Michael?
Yeah, so the discretionary grants process is just being looked at the moment, and I am involved in some of that conversation about trying to make sure that it is reflective of the needs of voluntary sector organisations as well. I've only just been joining the conversation, being really honest, so I'm going to look into what the timescales of that, and I'll be able to feed that back in a bit more detail with Nigel. But I am part of the conversation now, just to look at what that process and criteria is going to look like. And for those of you who know me from my work on our Manchester Voluntary Sector programme, it will be very much about feeding in all of the learning and experience that we've had from working with the sector about making sure that it's open and as flexible as possible for the sector. What I will say, and being really, really honest, is that there is a difficult challenge that there is not going to be enough money to go around the system. And we need to make sure that we're taking a full view on all of our kind of current resourcing and funding when any decisions are being made. But I will be pushing to get some strong criteria in there that will be reflective of the needs of voluntary sector organisations. So yeah, I'll come back to you, Nigel, with a timescale. I'm talking to some of our senior leaders of that section this week, and I should have some a bit more detail to come back to you with.
I think there's also the Wheel of Manchester funding as well, the charity funding, and I know that we've had over 200 applications from various VCSE sector members, and I think there's about 680,000 that has been issued in the last 4 to 5 weeks from that. So I think we can also share the information about how to access that as well.
Fantastic. Yeah, I think we're going straight back to Michael potentially on this one. We've got another one saying, are there any thoughts about our Manchester's additional funding or extensions for groups whose plans and projects have had to shift in response to COVID-19?
Yeah, similar to what I was saying before that. Obviously, all our Manchester groups who we work with at the moment have been speaking to members of my team about their current situations, and we'll continue those conversations. But like I said, we can't confirm what the position is until after the budget conversations happen. I know from the conversation with the treasurer and exec members, we're really keen to continue that, but I couldn't confirm what's going to happen at this minute in time. I am optimistic, and as soon as we are able to share some more, we will do. I am conscious of timescales as well, because as many of you will know, we normally put out programmes around the September-October mark. So we're in the final year of our Manchester Voluntary Sector programme, and we would usually put out our next programme this September, October. I would say confidently now it's unlikely that we're going to be able to do that at the moment, but once we've gone through the budget setting process, I'll be able to confirm exactly what is happening as soon as possible.
Yeah, and just to reassure people, it's a very live discussion at the moment, both between councils and government around funding arrangements, and our city treasurer is right in the middle of that. And I know that there is an intention for an executive update on the budget position either June or July. So you know, the work is ongoing at the moment, but I'm quite sure that we will have greater clarity on the budget positions for councils in the next few weeks.
And we've got a couple of questions around PPE. I know Mike has posted something in the chat box, posting people to our page for support for that, but I just thought I'd give you the questions anyway. So we've had one from Karen from Being There about accessing PPE, because they would probably able to relaunch their hospital transport services, they could. And also people saying that they're awaiting more info on PPE. As a nursery, it's been very difficult to order gloves and aprons, which are much needed. Any thoughts?
Yeah, if I start on PPE and then Michael might come in on the specifics for this sector. PPE has been one of those really, really challenging areas, and not just in Manchester but nationally. You know, there has been a real challenge to ensure that the NHS have got the right level of PPE, and they're right at the front line of working directly with patients that are infected with COVID-19. And then we've also got people working in care homes, as well as all of the other services that use PPE on a daily basis. So we have been working, Manchester and Trafford did set up themselves and have got a joint procurement hub around that. And we have tried to make sure that PPE is coordinated across the system, so that there is a focus on the NHS, but also on a focus on wider services. But there is a challenge in terms of not just a local but a national shortage and getting hold of the right sort of PPE. I think if any particular group is experiencing significant issues, they should just let us know that, and we'll see how we can support that. But there is a challenge. I think the government guidance as well at different points has been confusing. So you know, at different points it has advised different levels of PPE that have been required, and I think we're getting to a stage now where there is a clearer picture of what is required for different sectors. So if any particular group is really struggling with that, come back to us and let us know. But I think Michael has issued the link as well, where you can go on the council website to see what can be accessed and how.
Fantastic. Did you want to add anything, Michael, or are you okay?
I was just to say, Mike's posted it today, but like I said, myself and colleagues at Macc, I think, joining the PPE discussion, I think Thursday. So we'll take some of the conversations directly there, just about looking at the demand and the response to the PPE request. So I'm happy to pick those questions up and take them directly to the meeting on Thursday with the Manchester and Trafford Hub colleagues.
Brilliant. And a few more questions have just come through that are on different topics, so I thought I'd cover those ones. So are there any talks around digital support for people who previously did not have any access to this area? So for example, the supply of internet or tablets, etc. So I think we're talking about digital inclusion.
Yeah, so there is lots of work supporting digital inclusion. So certainly our libraries and our schools have been doing work with different groups around some of that. It is one of the areas that you know, needs to be a clear focus for the future. A lot of services are now more available online, and it's important that people are able to access, particularly as we're still in this phase of restrictions, as much as possible online. I think though one of the big challenges, and I know I've got some anecdotal examples of where that's been supported, is that it's not just about having the internet or the access to the iPad. There are some families where they might have access to the internet and even got an iPad or two in the home, but the numbers of people that need to use it and the time that they need isn't sufficient. So sometimes it's about you know, how much of that is available to people. We've then got a number of people, when I talked about dependency earlier, a number of people who, if they were able to do their, you know, to order their food online, then they would, but it's not something that they've ever done before. And certainly a lot of the over 70s groups that we're having to support are not familiar with shopping online or paying for goods online. That's not universal. You know, a lot of over 70s do that, but there's a significant number who don't and don't trust those sorts of systems. So digital support and digital access to digital appliances and internet is a big issue. But there is work going on around that, but there needs to be a lot more for the future.
Brilliant. And then lastly, am I okay, Nigel, for one more? He's doing a nod. So we've had a comment or a an ask here from Annie from Macc, who said it would be great to have some reassurance regarding post-COVID-19 and post-emergency funding regarding longer-term multi-year funding for the VCSE sector. Any comments? Nigel's doing a big, massive grin.
Yeah,
Always good to see people grinning.
I think Michael's probably covered that already. We'd love to give as much assurance as people would like. However, we have got to be realistic, and I think what the important message is that we will work together on this over the next 3, 6, 9, 12 months. We know the importance of the VCSE sector in the city. But we also know that resources will not be as as available as we might want them to be, and we'll have to get that balance right.
And there are a few questions that have gone unanswered, but I know we've only got a minute left to wrap up. But these will go to both Fiona and Michael to do a written response, and we will get them sent to all participants along with the resources pack that we'll be sending out.
Okay.
Okay, thank you very much, Danny, for doing that, for handling the questions. And thank you very much to Fiona and Michael for coming and talking to us about the City Council response. As Fiona says, this will not be the last one of these. We will be sending out some information after this one, and we will be doing this again. And there's a long way to go in terms of the recovery process for COVID-19. And we are going to be planning this and working together for a long time. It's really important that the voluntary sector and the City Council work together hand in hand in this. And we have a huge amount to offer to that, both in terms of the work that we do in terms of services, but also the work, our knowledge and our expertise that we can offer in terms of all of the different issues that we're going to we will be dealing with, many of which Fiona had mentioned. Before we go, if you would, I'm going to unmute everybody just so that you can say thank you to Michael and Fiona, and if you can just clap or whatever you want to do. Okay.